Bipolar disorder is mood disorder characterized by periods of depression and periods of abnormally elevated happiness. So, extreme shifts in mood, from depression to mania, is bipolar disorder. If persons is just moody in his or her feelings and behavior changes frequently, it doesn't indicate bipolar disorder. The main characteristic of bipolar disorder is abnormally elevated mood, which can last for several days. Such elevated mood should be abnormal. Means, person loses contact with reality. Such dramatic highs, called manic episodes. Again, mania is always associated with psychosis, episodes when person loses contact with reality, such as delusions, strong beliefs of grandiosity. Hallucinations, delusions of power and wealth, while reality indicates opposite. If mania is less severe, it is called hypomania. Between maniac and depressive episodes can be normal stable mood. A patient with mania is often hyperkinetic, unpredictable, and erratic. They often are garishly dressed, display negligence of social propriety, demonstrable via excessive friendliness, boundary violations, agitation, or other improprieties. Impaired judgment is the distinctive feature of mania, along with limited insight. They appear to be unnaturally happy or euphoric, however, irritability is also observed, dispositionally. A manic patient will demonstrate pressured speech, which implies a rapid and continuous production of speech that is difficult to interrupt. Reciprocally, speech is slow and soft, in depression, marked by low energy and activity, a feeling of hopelessness. During depression, they are unable to perform everyday tasks. People with bipolar disorder often have repeated thoughts of death and suicide, and they have a much greater risk of dying by suicide than the general population. The condition is classified bipolar I disorder and bipolar II disorder, according to how strong is maniac episodes. If maniac episode is fully presented, then it is bipolar I and has poor prognosis. If maniac episode is less severe, called hypomania, then it is bipolar II. Exact mechanism underlying the disorder remains unclear. But, genetic influences is dominant. Around 80% of cases. The average age of onset for bipolar disorder is 25 years, but some people develop the condition much later or much earlier in life. Mechanism. Bipolar disorder is thought to be associated with abnormalities in the structure and function of certain brain areas responsible for cognitive tasks and the processing of emotions. Emotional circuitry of the brain can be divided into two main parts. The ventral system regulates emotional perception, includes brain structures such as the amygdala. And the dorsal system, responsible for emotional regulation, includes the hippocampus and other structures. The model hypothesizes that bipolar disorder may occur when the ventral system is overactivated and the dorsal system is underactivated. It causes exaggerated emotional perceptions while limited regulation and control. Commonly, diagnosis is based on the self-reported experiences of the individual and/or abnormal behavior reported by family members. One episode of mania is enough to make the diagnosis. Treatment. Lithium is the gold standard for the treatment of bipolar disorder, as long-term use has demonstrated a reduction in suicide risk. 50% to 70% of patients treated with lithium show a reduction in mania. Mood stabilizers, lithium and certain anticonvulsants such as valproate and carbamazepine, as well as atypical antipsychotics such as aripiprazole, are the mainstay of long-term pharmacologic relapse prevention. There is some evidence that psychotherapy improves the course of this disorder. Prognosis. Bipolar I disorder usually has a poor prognosis. 50% of patients experience a second episode within 2 years of the first episode. There are reports of increased mortality as well, with findings of one study which followed patients over a 30-year period showing that circulatory disorders and suicide are the main causes of death.